Okay, Foxies, what I want to do real quickly is I just want to go over a case real quick of one of my patients. This guy is really, really in rough shape. He was in the military. He was exposed to tons and tons of different shots, anthrax, I mean, lots of stuff. And I'm going to really focus on one thing today, which is going to be an iron status problem. So here's his age, 37 years old. I blacked out his name and stuff, but you can see chronic neck pain, chronic neck, back pain, muscle loss, and joint tendon deterioration. Now, one thing is we took his labs. I took 12 to 13 vials of blood on him. And then what I really want to kind of focus on is something that came back. Now, here, what I like about this report is this is a functional medicine report. So anything that's in normal color right here, that tells you what normal is. That's where it should be. Now, anything that's in yellow, that would tell you would be, this is the analogy I'd use. This is like a string, a piano that has a string that's out of sync. This would be a string that would be broken, and this is like an alarm state, really, really bad. So out of all the markers here, he has 19 markers that are strings that are out of sync, 12 that are broken, and then 3 that are really, really bad off. Now you have to realize when people come to me, right, that have been flexed, I mean, you guys know you've tried everything, you've done the conventional system, and you've never gotten any results. This is why my approach here is an individualized, custom tailored program that fit your needs and figure out exactly what's going on. So today I just want to cover really one thing in here, and this is iron status right in here. So what happens in here is when it comes to priority, so one of the things, the very, very number one priority is if someone is anemia, if they have not enough iron, and then glucose levels. Now when we talk about having not enough iron, there's also a thing where you can have too much iron in your body. So this is exactly what's happened to Paul. This guy's name is Paul. Is his body has too much iron, and these are all the indicators that indicate that he has too much iron. Now guess what? How many doctors have done functional medicine tests to determine that he has too much iron? Exactly how many? 0. He's in the military, he's gone to the VA, he's gone to primary, he's gone to a litany of doctors. He has paperwork that is 3 files, 3 feet thick. So this is really where it comes down to is if you want to get better, you need to take the time out of it, and you need to figure out what's happening. So you see this right here, this is this hot pink right in here, this is an alarm state. This is an alarm state. This is a broken string. This is a string that's out of sync. So all these indicate that he has too much iron. So here's another indication, too much iron, too much iron, too much iron, too much iron. All these indicate iron overload. Now, imagine this. Iron is so important that it's actually in your organs. So every organ in your body has iron. Now, when you have too much iron in your body, your organs accumulate too much iron. So imagine this. If you put your bike outside and it rains, it's going to rust. This is what happens when you have too much iron in your body. Your organs start to rust. It causes further mitochondria damage. The mitochondria are not functioning well. They get damaged and they cannot produce their energy. And then you have chronic pain. You have neurological symptoms. You can't sleep. All because this iron needs to be figured out. Now, here, there's really some simple things that you can do if you actually have too much iron. One, you can donate blood. Go to the Red Cross. Say, hey, I want to donate blood. Right? You can donate blood. You can stop eating foods that have iron, and then if it comes down to it, you can actually get a prescription to actually get blood draws like every 2 to 3 weeks. But this right here, this level, just to give you a reference right here, this ferritin, this should be between 40 and 80, right? He's at 613. His organs are literally like rusting from the inside out, and no one's actually caught this and looked at this. Now, one thing I like about this is down here, okay, so here's some other iron markers, and you can just look at his labs right here. Here's some other markers that we're not going to address right now. But then what I like about this here is it kind of gives you a description. So ferritin, increased levels, iron overload, increased risk for cardiovascular disease, inflammation, oxidative stress. Right here, here's another marker is increased because of too much iron. Here's another marker, too much iron. Here's another marker, hematocrit, too much iron. Transferrin here is a sign of iron overload, too much iron in the blood, and it's above optimal. So I'm going to give you a couple links below that you can look at some YouTube videos from 𝗥𝗶𝘀𝗆 that talks about the iron level and the iron status. So here's too much iron in your body right here. Increased iron levels are associated with liver dysfunction, conditions of iron overload, and hemochromatosis. So also, when you also have too much iron in your body, guess what happens to your liver? Your liver starts to break down because it's rusting from the inside out. Guess what this marker right here is? This is what? This is a liver marker. It's positive. It's high. So at the end of the day, I just wanted to give you a short video on one thing that we found in here that was overlooked for basically 25 years. And I want to let you know, where there's hope, where there's help, there's hope. Where there's help, there's hope. Take care. Bye-bye. I hope you found value in this.